Hi, my name is Daniel Mendoza and I work with the Elling Center for Civic Leadership. And today we have Dr. Roberto San Martin who will be talking with us a little bit about what Los Quijotes is. And Dr. San Martin.
Well, thank you, Daniel. It's really a privilege to be here. And I'm really excited about getting the message out, not only to the university students, all of the university students, but especially to the Ethnic Center.
Okay. And so I have a few questions for you about Los Quijotes, but first, would you like to talk a little bit about what Los Quijotes is?
Sure, I'd be very happy. And I've brought along a little PowerPoint that I hope would share our thoughts and make it easy for the students to understand, who we are and what we do.
Okay.
Is that okay? I'll go ahead and start it.
The Quijotes and University of the Incarnate Word Edling Center have a strong collaborative relationship, and the Edling Center at the university has their mission statement of transforming students to become enlightened global citizens through collaborative community service as guided by Catholic social teaching, as well as respecting all students in their faith journey. The history of Los Quijotes goes back many years. It was originally started at Christus Santa Rosa Hospital. A few interested physicians, nurses, and actually the hospital administrator saw a need for providing medical care for the medically indigent in Mexico. It just so happened that one of the Sisters of Charity of the Incarnate Word from Mexico City, Sister Maria Luisa Velez, invited this small group to come to Mexico City back in 1989. As you can imagine, there were many difficulties encountered. They did not know how to get their medicines across, their instrumentations, and when they finally got to the convent, they were left only with their stethoscope to examine patients and not really have any medications to help the patients. They moved on to several other cities in Mexico, and it wasn't until 1998 when another Sister of Charity of the Incarnate Word in Oaxaca, and this is the capital city, Oaxaca, in the state of Oaxaca, in 1998, again invited to come to the city of Oaxaca. And as it happened, as soon as they got there, the sisters left. They were reassigned. But the group decided to stay, and with the help of many individuals, they started and made a go developing relationships with the people who met them from the city health department, some local physicians and businessmen. And the name Quijotes comes from the Spanish literature of Don Quixote, who was a dreamer like we are dreamers. And it related to the group adopting the aspirations of wanting to do good, to fight gigantic health problems with words, not fight windmills, with our medicines, our hands, our goodwill and enthusiasm. So we have developed a strong relationship with the Etling Center for Civic Leadership at the University of the Incarnate Word. It's been going on for about 4 years. It really took off under the leadership of Dr. Barbara Aranda Naranjo, who really embraced the idea of having students go and develop some skills related to giving back to the community in terms of their local and global leadership. We had several years before this arrangement taking optometry students and pharmacy students, and we have developed that in a strong and healthy position, stationed for good growth and to benefit not only the students, but for everyone else who travels with us. Our founder was Dr. Hugo Castañeda, who was involved back in 1989, and sadly, because of health reasons, he's not able to join us this year. Our mission contains outpatient clinics, outpatient surgery, and we've done educational presentations at the medical schools. We have partnered with local physicians in an international ministry which not only helps to expand the name of Christus Santa Rosa, but also of the University of the Incarnate Word. We have a very unique relationship over the past 20 years in Oaxaca. We have joint efforts by at least 10 different entities, including the state and the city of Oaxaca, the Department of Health, the two hospital systems, the private and the government, the Rotary Club, the two medical schools, and of course, an auxiliary group formed in Oaxaca called the Quijotes of Oaxaca. It is all done under a spirit of cooperation in promoting the medical, surgical, dental, and allied healthcare in Oaxaca. And well over 100 volunteers from the city are there to help us. The support comes not only from the local government, but also from the nursing school and many volunteers. On the left, you see two of our original founders, Dr. Hugo Castañeda and Dr. Yolanda Perez, who's a ICU nurse. On the right is Dr. Diana Ballesteros, who is a faculty member of Christus Santa Rosa Family Medicine, who helps bring two family medicine residents on each trip. We have student involvement, which is really very important for our group, not only the family medicine, but pharmacy students and optometry students, as well as nursing, physical therapy, and other UIW Etling Center students. Some of the local nursing students provide the initial screenings, the vital signs, and here they're taking the actual blood glucose levels to be entered into the patient record. Our pharmacy is very unique. It's headed by Jim Stoltz since the very beginning, and we travel with approximately $100,000 retail value of medications, which are provided free of charge to the patients. It is a well-run group that fills about 600 prescriptions a day. On the right is our building for the future, a Oaxaca clinic to house exam rooms and 2 surgical suites. The Rosenberg School of Optometry has been coming for the past 5 years, and this is the group from 2015, along with some of the volunteers who helped us in the clinic. The patient education has been done by different faculty from the university, and Dr. Manriquez was helping Dr. Barbara Aranda Naranjo explaining community health, diet, and other items of interest to the people to get them on a healthy course towards improving their general state of well-being. The clinic, everywhere we go, is just jam-packed. These are just some typical slides. And one of the things that we notice is these people have been there since 3 or 4 or 5 o'clock in the morning, waiting for us to arrive at 8 without eating breakfast or lunch, and they do not complain. They sit there very patiently, are very polite, and say thank you, and many times they bless us when they leave. This is just the ophthalmology clinic. The total clinic sees about 3,000 patients in the Monday through Friday work week. And the optometry clinic will see almost half of those patients. On the right is Dr. Powell, a faculty member from the Rosenberg School of Optometry, who is a tremendous help in teaching and helping us to see the large number of patients on a daily basis. I take the students into surgery to observe on the left hand of the surgeon, and they take a microscope view, and they really learn instead of trying to see on a television monitor. And this is one of the highlights for the optometry students. And of course, the food. As you would expect, these slides were taken by some of the optometry students, and they just love the food, the hot chocolate, the queso fresco, and they just love to go to different restaurants. And one of the things that we do is we follow the motto of Christus to extend the healing ministry of Jesus Christ. So in terms of what can be done in the future, how the students can help, how anybody can help with donations, either in money or in kind, we can get more groups and more volunteers involved here at the university. We can certainly use more Christus support. With the new surgery center, if we ever get enough money to open it, we will need to equip it. Christus Muguruza has a hospital in Monterey, and they certainly could provide physician support. This is a poor child who was just outside my exam room in a courtyard when somebody yelled, get a doctor. And he was probably about 4 months old and had choked on a bottle which had some sort of a meal, but it was very concentrated. So by choking, he had what we call a respiratory arrest. And out of luck, the physician who you will see here on this video is a pediatric emergency room physician who provided CPR and removed the contents from the airway. And sure enough, after a visit to the emergency room, the child came back, and the mom says, "Thank you for saving my child's life, and we made a difference to this one." Now, what does it mean that we made a difference? I'm reminded of the starfish story by Lauren Isley on every trip that I make, and I share this with the students. In the original story, a man was walking on the beach when he saw a young child picking up starfish one by one and throwing them back into the ocean. When the man asked, how could he really make a difference when there were thousands of stranded starfish on the beach? The young man responded without hesitation by saying, "I bet it made a difference to this one." In that video you just saw about that child, if we all 60 of us on that trip went, and the only thing we did was to save that child's life, it made a difference to him. Many times, we'll see lots of patients, and the lines are long and long, and it's 3, 4 o'clock, and the lines haven't gone down. And we're dead tired, we're sweaty, we're thirsty, and we look at the end of the line, and it just doesn't go down. And the students asked me, he said, "How do you do it?" And I said, "Look, these are people with feelings, and they're scared. They're scared because they don't know if we're going to find something wrong. They've been here a long time. They have traveled, probably. They may not have had a chance to take your daily shower like you do." And one of the things that I tell them is not to worry. We call that the smell of poverty. So they can recognize what it is to come from a poor area where these are medically indigent who are here requesting our help. And they say, "Well, how do you do it when you go from one to another and not even pay attention to the time?" And I say, it's real simple. I look at that patient and I say, "Is this you, Jesus?" And I have the strength to go forward.
I do have some few questions for you. The first one is, what do you see as the greatest strength of Los Quijotes of San Antonio in terms of teaching our next generation of medical providers?
Well, I think the greatest strength of Los Quijotes is the people. The people who are involved, the ones who have been there since the very beginning in 1989 and back in Oaxaca since 1998. All of them are there with a purpose of service. And service, I think, is a trait, a goal, an idea that I think the university considers very important for their students. I remember when I first started medical school, my guiding principle at the time was service. Not only to provide the best medical care that we could, but to think of the patient that we were treating as a person, as a child of God. And not forgetting that that person on the other end is holding us in high esteem and also has given us the responsibility of his care. That is a tremendous transfer of responsibility, and we do not take that lightly. We try to tell not only the students but anyone who travels that what makes the group strong is that we need to remember that these are people on the other end. People just like you and me that have fears, they have concerns, they have questions, and they're not just a number or a diagnosis. They're not Mr. Hypertension.
And how would you connect your own spirituality with the service that you've done here at Los Quijotes?
You know, I think that many times people ask me, why are you in Oaxaca? Why are you giving of your time and talent in Oaxaca, which is a long way away?
Mm-hmm.
It's south of Mexico City. You know, it's the state that borders Chiapas before Central America.
Right.
And I just tell them, I said, look, this is where I think God put me and God put the group. It's not for me to tell them, no, I want a better assignment. But what has happened, we have grown as a group, and our talents have been multiplied many-fold by the strong work ethics of everyone in the group. And that's why we're there, because we can see results in ourselves, in the students, and in how they were before and after the trip.
And over all the years of being part of this, how have you seen Los Quijotes impact the community in Oaxaca?
Well, it's really kind of neat, you know. Every time we go, our group is announced by the city or the state. This trip we're sponsored by the state. Sometimes we're sponsored by the city, and they announce the coming of our medical mission on television, on radio, and in the newspapers. But after a hard day of work, we go out to dinner as a group, and people just off the street say, are you part of Los Quijotes? They hear us, they know about us, and they thank us, even though we haven't provided any care for them. So the group is really well known in the community, and people come from miles away just so they can receive medical care free of charge, with medicines free of charge from our group.
Okay. How much of a change do you typically see in UIW students from the beginning of the trip to the end?
Well, probably the statement that affected me the most was when one of the students actually wrote on his own volition to the group, thanking them and saying it was a life-changing experience for me. And they're exposed to service, not just of giving of their own time and talent now, but hopefully they will carry this forward in their lives and be able to do that, whether it's at their church or their school or any other place that they can volunteer.
And how could you give any advice to those students who've never been to Mexico before and could have some concerns or may be a bit hesitant about traveling to Mexico?
Well, sure. And I guess, you know, if someone has never been to Mexico, they may have a wrong impression. Number one, it's not safe, and where we go is safe. Otherwise, the university would not let you go. Number two, they may think of Mexico as a backward country where everybody takes a siesta at 12 o'clock and wears white pants, a white shirt, and a sombrero. But that's not the case. The people are intelligent. A lot of them are well educated. And one of the things I found, besides all the good food, is that the physicians really want to give back to their community. And they work alongside us. They work with us. They don't work for us. We work with them.
And how many physicians are there?
Well, our group this year will number about 60. We've had as high as 70 and about 15 physicians. We take dentists, pharmacists, different kinds of specialty to include pediatrics, internal medicine, OBGYN. We take mostly ICU nurses. We take students in all the disciplines that we talked about, as well as faculty member from the university.
Okay. And if you could see Los Quijotes of San Antonio grow, in what way would you like it to grow even long after retirement?
Well, I don't plan to retire anytime soon, but I would really like to see more student involvement and to be with us, even if they don't travel, perhaps they can help us. We have a gala. We had our first gala last year, which was very successful. It was really sponsored by the Etling Center and the university at the Sky Room. And that was a great function. We raised almost $25,000–$30,000, and that's the reason we're able to buy our medications this year. We would hope that the students would want to continue to help us even after they graduate. And I think that this core of young students will be the group that will lead the Quijotes forward in the future. Because obviously we can't go forever and we have to retire one of these days. And we hope that the young, bright students with a lot of energy will take this group with their ideas and just really move it to the next 2 or 3 levels.
Okay. Well, thank you so much, Dr. Roberto San Martin.
It's been a pleasure.
And,
Thank you.
We'll see you